Gastroparesis, right, paralysis of the stomach, it's a pretty rare condition, and so we're still learning a lot about it. But what we do know is that whenever somebody does develop it, it can change their lives pretty dramatically. Unfortunately, there's really no good medication that's meant to be a long-term fix for that problem. So that's where somebody like me, a surgeon, comes in. What I include is endoscopic Botox injection of the pylorus muscle. The whole idea is we're trying to relax a muscle, and that muscle is the end of the stomach. And depending on how a patient tolerates that, if that completely relieves their symptoms, excellent. We go in, we do a surgery to make that change permanent. We call that a pyloroplasty, where we open up the end of the stomach and make it wider than it was before. For patients that do not respond to Botox, then we sort of think of it as the stomach as a failed organ. And so what we do is we remove about 90 to 95% of the stomach and then reroute the intestine to connect to the stomach. If anybody's ever heard of a Roux-en-Y gastric bypass for the purposes of weight loss, it is essentially the same thing. When we have patients that are suffering for months, years, sometimes their whole lives with gastroparesis, it's very satisfying to offer them a surgical solution that really makes them feel better from the moment they wake up. And we are talking about a life-changing effort. So we are seeing a lot of good outcomes with patients.